Florida has now confirmed its 11th case of measles since an outbreak started at a Broward elementary school, and what is being called a potential disaster by pretty much the entire medical establishment. The Florida Department of Health is not making any information or data available to the general public about where exactly these cases were, how many people are being tested, or how many potential cases are being investigated. And they're making no public information available on their website. All there is right now to even recognize a measles outbreak is going on is a little blurb on the left that is for healthcare providers, which links to a PDF of a presentation that includes an entire slide on potential vaccine injuries. Now, we know from previous investigations of Dr. Joseph Ladepo, who was hired to replace Scott Rifkes during the COVID-19 pandemic, that he has been caught falsifying COVID-19 data and analysis to promote a political agenda. The agenda, of course, that Ron DeSantis has leaned into and apparently learned nothing from the humiliating defeat of his failed presidential campaign because he's leaning into it harder. The CDC advises that after a measles case has been confirmed or is suspected, that any people who are potentially vulnerable isolate for 21 days. That, the inoculation period and these symptoms don't even develop until like 10 to 14 days. So if you're not vaccinated, especially if somebody is susceptible, if they have younger siblings who are not vaccinated because you can't get it till you're 12 months old, or other immunocompromised people, quarantine for 21 days. What the Department of Health decided to do was to leave it in the hands of the parents, as the letter from Ladepo, that is now quite infamous across the internet, advised, which meant that they could go back to school without isolating. Despite warnings from the CDC that not issuing any kind of isolation or even a stay away from school if you're not vaccinated and been exposed to measles, the state's continuing along this path. It's not enforcing any of the basic public health measures that have long kept viruses like measles at bay. Vaccine rates in the state of Florida have steadily declined since 2020. Not surprising considering who's in charge. And Florida is well below the 95% that they need to have inoculated in order to keep measles at bay. They're at about 91% now. Now, there's also a lot of disinformation going on about measles. People saying it's not that serious. It is absolutely serious. The mortality rate is between 1 and 15% of cases, depending on the healthcare infrastructure and the level of development of the country. It can lead to permanent disfigurement. The most common effects of it are diarrhea, encephalitis, ammonia. I mean, this stuff can kill you. It can especially kill children who are too young to be vaccinated and who are under the age of 1, because that's when you can get your earliest vaccine. So this is a clear and present public health danger. The CDC under Biden, unfortunately, has not sought to take over these types of investigations. If they had, perhaps Florida would not have such a high age-adjusted death rate post-vaccine and post-Biden. So unfortunately, the people of Florida are just kind of left on their own. There was also a death of an 11-year-old from meningitis yesterday, I believe, or today. And leprosy is now endemic to Orange County and Orlando area. So that's great. And of course, you have RSV and COVID, as always, higher in the state of Florida than most other places in the country. And as I told NBC News, this is the absolutely predictable and yet preventable outcome of this rhetoric against public health and public health science that can only ever lead to this. And whether or not the federal government will step in and actually help people, save people's lives, when DeSantis and the Florida Department of Health clearly don't care and are actively sacrificing people's health and their lives for their political points, here's hoping. Thank you for watching. Please follow me here and at all of the major social media platforms. And remember to subscribe to my Substack, which is at rebeccajones.substack.com. And thank you all for your support.